Irregular periods vary in length or flow. Stress, weight changes, or hormones can cause them. See a doctor if they persist or cause pain.
Menstrual periods typically last 4 to 7 days and occur roughly every 28 days. Examples of irregular periods include:
What are irregular periods? Most women have periods that last 4 to 7 days, every 21 to 35 days. The average cycle is 29 days. Many things cause irregular periods, such as changes in hormone levels, stress, certain health conditions, medications, and more.
Your period is still considered regular even if it varies slightly from cycle to cycle. Slight variations are normal.
Examples of irregular menstruation include periods that occur fewer than 21 days or more 30 days are.
Irregular periods can mean cycles shorter than 21 days, or missing 3 or more periods in a row.
Severe pain, cramping, nausea or vomiting, bleeding between periods after menopause or sex.
Your cycle may not always be predictable, and that may be okay. It's normal to have slight variations in length or flow. Hormonal imbalance, uterine fibroids, weight changes, and stress are common causes of irregular periods. Doctor, I haven't had my period in months.
That's amenorrhea. It's defined as no period for 90 days or more, unless you're pregnant, breastfeeding, or in menopause. If you haven't started menstruating by age 15 or 16 or within 3 years of your breast developing, you may also have amenorrhea. Oligomenorrhea is a condition where periods occur infrequently. You may go more than 35 days between periods or have 6 to 8 per year. Dysmenorrhea is the medical term for severe menstrual cramps. Some discomfort is normal, but severe pain is not.
Abnormal uterine bleeding includes bleeding between periods, prolonged bleeding, or extremely heavy periods. What is the cause of my irregular periods? They are ranging from stress to more serious underlying medical conditions.
In endometriosis, tissue similar to the uterine lining grows outside the uterus. This causes inflammation, leading to adhesions and painful ovarian cysts.
Pelvic inflammatory disease, or PID, is a bacterial spread from the uterus into the fallopian tubes and ovaries.
Pelvic inflammatory disease is typically caused by an untreated sexually transmitted infection. Bacteria spread to the uterus and upper genital. In polycystic ovary syndrome, your ovaries make large amounts of androgens, which are a type of hormone.
This hormone prevents or delays ovulation, causing with PCOS. Period.
This is primary ovarian insufficiency, a condition in women under 40.
Primary ovarian insufficiency can occur during treatment for cancer or if you have certain autoimmune conditions. Thyroid and pituitary disorders affect your hormones, causing irregular period means too little hormone, while hyperthyroidism means too much.
You may experience heavy menstrual bleeding if you develop a bleeding or blood clotting disorder.
Uterine or ovarian cancer can affect your period. You may experience heavier bleeding or missed periods.
Disruptions in your routine can impact your cycle. Lifestyle factors include stress, weight changes, strenuous exercise, and illness.
Other causes of abnormal menstruation. Certain medications, complications of pregnancy or breastfeeding may.
Most birth control pills contain hormones that prevent ovulation. Stopping the pill can cause irregular periods for up to 6 months.
Factors affecting female fertility include medications like steroids or blood thinners, and surgery or blockages in reproductive organs.
My periods are irregular.
Start a calendar to track them.
We start with a detailed medical history and a physical exam. Then, blood tests check hormone levels, and an ultrasound gives us a clear picture. Note symptoms, the amount of flow or if you experience bleeding between periods or passing large clots. Share these with your healthcare provider. To diagnose irregular periods, we'll discuss your cycle and medical history. Okay, doctor. Next.
You might also order certain tests, including a pelvic ultrasound. This can detect irregular bleeding due to uterine fibroids, polyps, or an ovarian cyst.
Hysteroscopy allows your provider to look inside your uterus to diagnose and treat certain causes of abnormal bleeding. If medication doesn't help, your provider may recommend surgery. Possible medications include hormonal birth control.
How are irregular periods treated? The treatment depends on the underlying cause. Medications are often the first treatment. A period lasting longer than 7 days. Vaginal bleeding or spotting between periods or after menopause.
Make sure you get enough rest. Practice stress reduction and relaxation techniques. Use headband powder for receptins. How can I lower my risk of having an irregular period? Try to maintain a healthy lifestyle by exercising moderately and eating nutritious foods.
Contact a provider if you have irregular periods or severe pain.
Or unusually heavy bleeding, large clots, or foul-smelling discharge. Should I be worried if my period is irregular? Irregular periods may be nothing to worry about. However, certain symptoms could be a sign of a bigger problem.
Irregular periods are more common during puberty, around age 9 to 14, and perimenopause, around age 50.
There are surgical options for irregular periods. Endometrial ablation destroys the uterine lining. Embolistic blood supply.
How much delay in periods is normal? Slight delays are typically okay. Some can predict by for sudden changes. It's good to get it checked.
Is it normal to miss a period for 2 months? Skipping 1 or 2 isn't ideal, but take a look at any changes in your life recently.